This is the stick. Use the stick to loosen the muscles. You can use it on all the areas of the muscles, but avoid rolling it directly over the bone. You can think of each area of the body having 4 sides, a front, a back, an inside, and an outside. You want to do 6 to 8 passes over each of these areas. This will help not only loosen up the muscles, but decrease any of the scar tissue and lactic acid buildup that's been there. These exercises are done on the foam roll, so start sitting in front of the foam roll and lay back with your weight on the foam roll. You can gently roll back and forth to work out the muscles of the spine. You can also use this foam roll to work out the back of the shoulder as shown here. Lay on your side, put some gentle pressure on the back of that shoulder and roll gently back and forth. You can also use the foam roll to work out the hip area or the sides of the legs. This is a very commonly tight and sore area on people. So do this one gently, but you can work all the way down the side of the leg or the back and outside of the hip. Here he's demonstrating the outside of that leg over the iliotibial band. So we're going to show you a series of stretches now. Each stretch you are going to hold for 20 to 30 seconds. The first one here is great for your low back. Bring your knee into your chest and gently grab below the kneecap. Hold that for 20 to 30 seconds and then you can switch sides. You can also do another version where you bring both knees into the chest and again hold for 20 to 30 seconds. These are hip drops, so lay on your back, knees bent, and move your knees side to side gently together. You can repeat this 10 to 15 seconds or 10 to 15 times. Dr. H is going to demonstrate a pelvic tilt exercise. So this is very important for helping to stabilize that spine and learning to use your core muscles. So what he is doing is he is drawing his belly button towards the floor. So flattening his spine on the floor. You can put your hand underneath you to make sure that your spine is moving in that general direction. But what you will feel is your pelvis moving forward and back. And most importantly, draw that belly button towards the floor. Again, repeat 10 to 15 times, a couple times a day. This is a great stretch for the hamstring muscle as well as the back of the knee and the calf. You want to lay on your back, bring one leg up into the air. You can use a towel or a strap or a belt, whatever it is you have at home, to get that tension on the leg. I want you to keep your arms relaxed and push that heel towards the ceiling like your foot is going to be flat on that ceiling. You can leave your other leg bent to support your lower back and hold that on each side for 20 to 30 seconds. This is a great stretch for that low back. You're going to bring one leg over the other and gently draw it across the body. This will create a nice rotation in that spine and a nice stretch for that lower back. Again, hold this for 20 to 30 seconds on each side. The next stretch is called the bridge. You're going to bring your feet hip width apart, knees bent, flat on the floor. You're going to gently push through those feet and lift up that pelvis. You'll feel this in your glute muscles, also possibly in your hamstrings. And it's great support for that middle part of the body, those core muscles and low back. So you can bring the body up, hold it for a few seconds, and then you can relax it back down. If you're a little bit stronger, go ahead and bring it up, and you can hold it up there. Important also is that you keep those knees in line with your pelvis. Don't let those knees move out to the side. This is a great stretch for the front of your hip, the hip flexor, also known as the psoas muscle. So start in a kneeling position here like Dr. H. Most important is that you want your hips facing forward in the same line. What will happen is your left hip will tend to rotate backwards. I want you to bring it around and then gently lean forward or lunge forward through that front leg. You should feel a nice stretch on the front of your left hip. Hold for 20 to 30 seconds and repeat on the other side. Okay, so here's another variation of the hip flexor stretch. You're going to start feet hip width apart, feet facing forward, back foot facing slightly outward. Most important is that you want your hips facing forward in the same line. What you're going to do now is gently lunge forward on that front knee, remaining upright. You should feel a nice stretch through the front of that left hip. Then reverse the stance and do the same thing on the other side. Hold for 20 to 30 seconds each side. Okay, so this is a nice stretch for the front of that thigh, the quad muscle. So stand up against a wall or countertop where you have some support, because you are going to be balancing on one leg. I want you to bring the other leg up behind you, grab onto it with the hand, stand up nice and straight. Most important is that knee faces towards the ground and those knees are next to each other. You should feel a nice stretch through the front of that quad or that thigh muscle. Hold for 20 to 30 seconds and repeat on the other side. This is another variation of a quad stretch or a stretch for the front of the thigh. You can do this facing down either on your bed or on the floor. Pull up one leg behind you. You can either use a strap, a towel, or a belt if you can't reach your foot, and gently pull that foot towards your buttocks. Hold that for 20 to 30 seconds and repeat on the other side. This is a great stretch for those inner thighs or adductor muscles. You're going to bring your feet together in front of you, let those knees drop out to the sides, and hold that for 20 to 30 seconds. If you need a little bit deeper stretch, put some gentle pressure with those elbows on the thighs. Make sure that back is nice and straight. Dr. H is going to demonstrate some neck stretches. So first one, he is going to show you how to stretch your trapezius muscle. So gently, you're going to bring your head ear to shoulder. Very gently, you can apply a little bit of overpressure and make sure you drop that right shoulder. Hold that for 20 to 30 seconds and switch sides. One often neglected muscle are the scalene muscles. To stretch the front of the neck, you're going to place your hand directly over your collarbone, just to traction it down, and then gently lean up and away from your hand. You should feel a nice stretch through the front of the neck. Hold it for 20 to 30 seconds and then repeat on the other side. We're going to show a nice way to stretch your chest muscles or your pectoralis major. So using a chair, gently put your hand on the chair, arm out to the side, and lower your body through. You should feel a nice stretch through the front of that chest. Hold that for 20 to 30 seconds and repeat on the other side.